So thank you all once again for joining us today for this new co-hosted session by AI Detroit and AI Michigan on returning to job sites, whether those are active and under construction or those that are already occupied. My name is Lauren with AI Detroit. I would just like to do a few housekeeping things before we get things started. I would like to remind everybody of AIA's Antitrust Guidelines and their commitment to diversity and inclusion in all things, including this conversation. So we will be conducting this meeting in full compliance of antitrust laws and always being inclusive with our discussion points. As a few courtesy rules, just moving forward in this session, please make sure that your camera is disabled. We want to leave room for our panelists to show their beautiful faces later on, and we do not want your camera interfering with their feed in any way, shape, or form. Also, please keep your microphone muted. And if you wish to speak or to ask a question, please do so in the chat box. And if we have time, we will certainly call on you to include yourself within the conversation. Now, with that being said, I would like to hand it off to AI Michigan's Vice President, Bob Hoyda. Bob?
Thank you, Lauren, and good afternoon, everyone, and welcome to today's town hall discussion. Today's discussion is about returning to another important part of our work as architects, project and construction sites. As you know, all construction sites have been reopened within the state of Michigan or restarted as of May 7th and are currently staffed. Today's panel includes two representatives from the construction arena, and they will probably both tell you that some of their project sites were never closed as they were considered essential construction. We welcome them both to our panel and thank them for their participation today. I think that we will lean on them heavily and their experiences during our discussion today. I know that Ryan Maybach of Barton Mallow will explain his participation in developing the construction industry standards through MERC for our returning to active work, or for their returning to active work within the construction industry. I'll let Ryan explain the MERC acronym and what that stands for. Like last week's discussion about returning to the office, today's discussion is being led by members of AI Michigan's COVID 2019 task force. Those of you who attended last week's town hall will recall that the task force is a group of members from across the state of Michigan, representing the various chapters and components of AIA across the state. The task force was formed as a vehicle to share information statewide amongst our firms, chapters, and those involved in the AIA, as well as outsiders in the architectural field. The AIA, the national component of AIA, has been very helpful in preparing and assembling documentation, which both monitors the current state of government programs, as well as lobbying on our collective behalf. The task force is focused on more localized conditions here within the state of Michigan, and specifics apply to us. Today's discussion is especially focused on the conditions within the state as it relates to construction sites and project sites. The task force really has a two-pronged approach to information gathering and disseminating of information. We've acted as quickly as we felt possible to gather information about the conditions affecting us, our offices, and how we move forward within the current pandemic situation. In a longer term, we expect to gather information about architecture, design, and the profession, and how we can serve our society and clients, both on a professional as well as, in some cases, beneficial aspect to governments, local organizations, and so forth, to kind of lend our experience, maybe even on a pro bono basis when appropriate. Today's discussion is intended to be about information sharing. No one on this panel is here to say that they have the answers on how their firms will handle the details of site or project visits. We are here merely to share our collective thoughts and ideas with you today. As I stated earlier, today's panel is composed of 3 architects, 2 contractor representatives, and an attorney who specializes in the construction aspects of the law. With that, I'll let the panelists introduce themselves, and I'll start by passing this off to Matt Christie, an architect and president of AI Grand Rapids, and we can move down the list from there. Matt?
Hi, thank you for attending today. I'm Matt Christie, project architect with Ghaffari Associates and current president of AIA Grand Rapids. I am currently doing CA work for a previously non-essential construction project, which has recently reopened since Governor Whitmer removed restrictions on construction.
Hi, I'm Danica. I'm a project architect with Dika Mahaman in Kalamazoo. Similar to Matt, my perspective is sort of boots on the ground, but the project I'm working on actually was deemed essential. So it is not stopped during the stay-at-home order, but as some of us has experienced, protocols have changed every couple of weeks for COVID. And full disclaimer, I do have a bit of anxiety every time I go to the site. So I'm really grateful for this conversation and then interested to hear what Todd, Ryan, and Scott have to share. So I'll let, looks like Ryan introduce himself.
All right, good afternoon, everyone. I'm Ryan Mivak. I'm CEO of Bard Mello. We're a commercial contractor based in Southfield, doing work pretty well throughout the state of Michigan as well as throughout the eastern half of the U.S. And so it had unique experience on a wide range of mass customization. We shut down about 123 projects in Michigan when the stay home, stay safe order was issued, but have had a wide range of different experiences and active projects, both in Michigan as well as throughout the eastern half of the U.S. And so that helped to feed into the Michigan Economic Recovery Council work, and happy to share a little bit more about that group and what we did here in a few minutes.
Yes, I'm Todd Macdonald with the CSM group, and myself, along with my team, was fortunate enough to be able to maintain around 65%, almost 70% of our projects were deemed essential. And so a lot of lessons learned, a lot of safety challenges, both physical and emotional, with the teams to be able to work through that process, and then making sure that we continue to create robust site-specific safety plans. So again, hopefully we can share some of our lessons learned and work going into site-specific safety plans and our plans on how to help protect any visitors to the job site as well as the trades.
Thank you so much, Todd. Scott, you have the last introduction.
Good afternoon. This is Scott Syrick. I'm an attorney at Plunkett Cooney. Plunkett Cooney is a regional law firm. We have offices all over the Midwest. I run our construction law practice group and have for many years. I represent principally design professionals and have worked with contractors to do both of that. And so I've had the opportunity and pleasure of knowing many of you, and was sort of a late add to this conversation, but appreciate the opportunity to be here and share what I have. So.
Thank you so much, Scott. So now we're going to move on to the Q&A. And I just want to set a few house rules before we get started. First of all, if our panelists could please activate their cameras at this time, I will stop sharing my screen shortly. We received many questions from our attendees who RSVP'd through Eventbrite, and we're going to be working through those first. If you are listening into the session now and you have a comment that you would like to contribute, please enter it into the chat box, which will be monitored throughout this entire process. And myself and Bob Hoyta will bring up any questions that we deem relevant and timely in the conversation. And with that, I am going to quit sharing my screen, and I am going to ask Bob Hoyta to kick the conversation off.
Great. Excuse me. Great. Thanks. A lot of the questions that came to us were about specific requirements of job sites. Todd, if you would kind of let's then back up and then have you start just talking about what your requirements are and maybe how they relate to the state requirements. That would be great. Thanks.
Thank you. Yeah, this is Todd Macdonald with the CSM group. And throughout this whole process, you know, the coordination between the executive orders along with the CDC recommendations, World Health, and OSHA, who also, you know, put some recommendations out. Well, we have to remember, and I think it was stated earlier at the beginning, that most of these are recommendations. And so businesses themselves really have to figure out what's going to be best for them and for their people. So we've made sure in the current state, I won't go back historically, but in the current state, every one of our projects, we have updated our site-specific safety plans. We have required all of our trade contractors, trade partners on the sites to update their site-specific safety plans to make sure that they have included COVID procedures. We actually are using a electronic QR code reading system that one of our daughter companies, Spark Business Works, has created. And so anybody that comes to the job site, whether it be a trade or a visitor, at the entrance, you have to scan a QR code, fill out a declaration in regards to your current health situation in order to be let onto the job site. We have lots of signage that talks about PPE as well as social distancing. And so I noticed in a lot of the questions the PPE was in there. But again, for us, our standard PPE is hard hat, safety glasses, high vis, and steel-toed boots. And then we've added to that what we refer to, instead of using masks, it's the non-medical face covering, which ties to the verbiage that the current executive order has in place. So that is a piece of PPE that all folks need to bring to them. In our case, when we have customers or architects even that come on the job site, if they don't have, hard hat, safety glasses, high vis, we still give that to them, but we do recommend, because of COVID and the cleaning and those kind of things, that in any of those cases, that if people can bring that with them. We do have hand washing, hand sanitizing stations, and we have added to all our job sites COVID cleaning crews. So they're just strictly doing sanitization on the job sites, and we make sure that each area of the job site where trades tend to congregate or use, so doors, handrails, scaffold, that those get cleaned at least 3 times a day.
So does anyone else want to talk about some of the safety protocols? And Bob, I'm sorry, because I was just trying to make sure that Ryan could join us again. Did we address the clarification of what the current executive order allows as far as architectural services on the site, or are we going to ask Ryan to address that question?
Let's now that Ryan, looks like Ryan is back and unmuted. I don't know how much of Todd's discussion you heard, Ryan, but welcome back. And maybe if you could talk a little bit about developing those standards and how that compares to the current state, I'll say directives or guidance, if you will. Appreciate that.
Sure. Hey, and yeah, apologize for that. I mean, timing is everything, as we're all trying to navigate getting used to all of these different tools. So my apologies. I'm not sure what happened. My laptop just completely froze up. So joining you from my phone. So hopefully that's okay. But yeah, I'll just maybe offer up a little bit of background and context on Merck, and it may just be interesting. But I think as the state went into its mode and its reaction to the COVID-19 crisis, and in particular, Stay Home and Stay Safe was issued, Jerry Anderson, who I would imagine many on the call know of, it really stepped up in a leadership role and engaged with the governor on assembling a group of business leaders as well as healthcare leaders, and pulling in really some pretty incredible minds from McKinsey as well as University of Michigan School of Public Health to try to begin the process of getting the state back in business and mapping out what that path to economic recovery really could be or needed to look like. And at first it was a bit unclear how best to move forward or proceed, but very, very quickly, with the help of McKinsey and a tremendous amount of data, the state was broken down into about 4.3 million or so Michiganders that engaged in 14 different industries and about a dozen facility types. And the thinking was very quickly to congeal and agree on best practices for combating COVID-19 based on facility type. And so those facility types included large offices, small offices, industrial, big box retail, restaurant and lodging, et cetera, construction being one of them. But, you know, as we can imagine, you know, and as, again, I would imagine, you know, folks on this call engaged in, you know, while are interested in engaging in construction and wanting to understand what best practices look like, you know, the reality of the construction industry is that it's incredibly broad and vast. And so the practices that were developed and the practices ultimately that were published by the state or included in the executive order really needed to include everything from the road that's being repaved out in front of your house to the subdivision that's being built down the street, all the way up to the, you know, the 9-digit major programs that are being developed in the state. And so the reality is that there needed to be a framework that could work and ensure a measure of you know, adaptability, to ensure adaptability, if you will, across that very, very broad spectrum. And then in turn, there are best practices. So I think there's 2 sets of documents that if you go out and look online, both even in the state of Michigan as well as on Business Leaders for Michigan, you'll see, again, different terms used. Again, what's included in the executive order, and then as well best practices. But just you know, I would be remiss in not noting. Really appreciated the opportunity to work with Mike Haller of Walbridge, a friend and peer in developing these best practices, and it really was fantastic through the better part of early April, where just a wide range of different construction-related entities, including the AIA, was consulted and asked for help in developing these best practices. So all told, we touched dozens and dozens of different entities, from larger entities, AGC and ABC, as well as really specialty and niche entities from waterproofing, masonry, roofing, et cetera, et cetera. So the industry as a whole came together I think through the associations in a very, very good way. I would reinforce and add that, you know, in a time when terms like data and science are used very loosely and very broadly, I can say that in particular, the best practices that are published on the Business Leaders for Michigan website, BLM COVID-19, I believe is the .com is the link. But the you know, those best practices were heavily vetted by the healthcare advisory portion of the Economic Recovery Council, which includes, I might add, the leadership of each of the university presidents, who all have a medical background themselves, as well as the CEOs of most of the leading healthcare institutions in the state, in addition to deep involvement from University of Michigan School of Public Health team of epidemiologists. And it really was pretty remarkable talking to them, and quite frankly, actually some very humorous conversations as well with them on their interpretations of our industry and some other risks that they outlined for our industry in terms of opportunity for, you know, communication of disease. But you know, all told, I can say without much reservation, I feel very confident, very comfortable in the practices that have been developed. They are, fortunately, you know, for all of you that have visited projects, which I would imagine, you know, most if not all of you have, you know that we're an industry that already is well suited to a couple things: well suited to PPE and well suited to adapting to evolving and changing conditions. So
Ryan, I want to give the panelists the other opportunities to contribute, because we have a lot of specific questions about what those practices are. And just so the attendees know, we will be following up this session with the recording as well as some of the resources that Ryan mentioned in his introduction. So if you didn't catch everything that he just said there, we will be thorough in our follow-up, and you will receive the information that he just graciously spelled out for all of us. So let's get into some the nitty-gritty about what the safety protocols are on some of these sites, because a lot of architects on this session are specifically looking for that information. So is PPE required for everyone working on a job site? And who's responsible for providing the protective gear? Who wants to take a shot at answering that question first? Go ahead, Matt.
Yeah, so for my specific project, Walbridge is the contractor, and they've taken a pretty aggressive approach to developing procedures for once Whitmer's restrictions were lifted. So they developed a protocols document that was published to all those who may visit the job site, and some of those are requirement to fill out a questionnaire of health prior to arriving at the site. Once on the site, a specific location where they're temperature checked, provided a wristband that's color coded per day, and then requiring a type of face guard while working on site. So those are kind of the CM protocols I've seen, and those go even to a greater depth when it comes to site logistics, incident reporting, and then assessment if there is an incident. So I think that's the typical procedure that's in place for most CMs, and that also comes to a point of wanting to make sure subs are comfortable coming to a site so that they can meet their new revised scheduling. So they've seen the first week open a little bit of hesitation from subs, but then as the second week rolled around, people started to adjust and adapt to those procedures and feel comfortable in the environment that they've provided. From an architect standpoint, our office is, as a request for an architect to arrive on site, we're required to get what those procedures are for those onto our HR department, who reviews to ensure that those protocols meet CDC guidelines, and then also confirm that the staff member is feels comfortable going to the site. So that's kind of what we have in place right now.
Thanks, Matt. Dinika, do you want to contribute a little bit to that conversation?
Sure. Sort of as I said, my experience has changed. So when we first started going to the site, before any executive order, there was a lot of just recommendations. And so varying degree of folks would choose to wear a mask or not wear a mask. And then most recently, it has been a requirement through the CM to have a face covering. For Deacon-Mahamon, as far as I know, we are all supplying our own, that additional level of PPE, the face coverings. But I would have no problem if I didn't going to one of the partners and requesting that additional required personal protection equipment, like they have supplied hard hats, safety glasses, and vests. And similarly to what Matt said, I've scanned QR codes, taken temperature checks and surveys. But I think if any point I wasn't comfortable, I would just feel free to reach out to the superintendent to say, hey, it's a new week. What are the expectations? And then I would just sort of, and this would be even true of other in-person meetings, I'll just let people know, hey, I'll see you tomorrow at 10 a.m. I'll be wearing my mask, just so it's super clear.
Thank you, Dinika. So you both mentioned temperature readings and screenings. Are any companies sharing that employee screening information, assuming anonymously, with job site owners? Is that even a necessary thing? Who wants to take a stab at that one?
This is Todd. I can speak
Todd.
to that again because of HIPAA requirements. That's one of the biggest challenges on a site. So we've had situations just even on the reporting piece to where we haven't found out about a tradesperson testing positive for COVID for a week. That's been the longest. A lot of times we're finding out, the next day. But again, they don't have to tell you who it is. We don't even technically have to know who the company is. But our trades have worked closely with us. They've actually gotten approval from some of the tradesperson themselves to be able to release that information, because you can imagine some of the panic that hits the site. Who is this person? Have I been close to them? As far as releasing the information to the clients, yes, we've worked with our attorneys, we have formal notification for all the trades on the site as well as the clients. And the declaration forms, we have an electronic system that we're using. But again, you need to be careful about the different systems that are out there, because you can't really be transferring that data via email because of HIPAA requirements as well. So it can be a slippery slope. And so we've coached all our people on not really releasing any information. And so the one thing that I will mention, and I've spoke a few times about this, is the most important thing that any of us can do personally or professionally is to know who's on your list. And by that, I mean, if anybody does contract COVID, you have to let the local health department know who you've been in close contact with. The definition of close contact is closer than 6 feet or longer than 10 minutes. So we all have really a personal responsibility to ourselves and our family and our coworkers to make sure that we really control who is on your list, because we've had crews, we've had, suppliers, companies have been closed down because people haven't been social distancing. Therefore, when one person gets COVID, you end up having to do a 14-day self-quarantine with a much larger group. The best way to avoid that is knowing who's on your list and to social distance.
So along that topic, does anyone else have policies on how they schedule visits and the protocols after? I think, Dinika, you mentioned about scheduling visits at the end of the day, then not returning to the office, you go home. Would you like to speak to that a little bit?
Sure. Well, I think there's always the number one question is if is it required? Do we need to meet in person? Do I have to go on site? I actually haven't been that many times. Technology is awesome right now. We're using videos, photos, FaceTime. So the number one question is it really essential that I'm there? If it is, then we go through kind of what everyone has been talking about. Do I feel comfortable? What are the procedures? And then, yes, usually it is closer to the end of the day when there are less trades there. I think maybe it was Matt actually or someone mentioned, I hadn't thought about not going back to the office. We are currently all remote, so that is an excellent thing to think about when we return to the office. But right now we all, are just going from our homes. But definitely considering when there are less folks on the site, and also my understanding is the CM generally clears the area a little bit more, or lets the folks on site know when there's going to be a couple of architects or engineers, just not only for our safety, but also for the rest of the site.
Thanks, Dinika. So along that line, job sites they can be large and hard to monitor everything. So for the contractors out on this panel, who is responsible for enforcing compliance with the required safety protocols you have in place, and how do you regulate that on your sites? Ryan, Matt, Todd, anybody?
I think in general, it first relies on everyone taking care of each other. And I think right now we're seeing a greater sensitivity to that. Each sub does typically have a concern about exposure and are acting appropriately. As far as 100% monitoring, I think that's kind of an impossible oversight to expect the CM to ensure that proper distancing is occurring. But I think in general, you're seeing people acting appropriately. And then as far as from a site visit standpoint, I mean, typically we're not really required to interact with subs. So kind of that 6-foot distance really doesn't ever or rarely comes into play in my experience thus far, which might partly be the phase that we're in construction right now. But so that's kind of been my experience.
Hey, and Bob, you had a comment on that or a question? Muted still, Bob.
Thank you. One of the things I wanted to point out in our policy is that, as I'm sure most firms are doing, is that, you know, no one should put themselves, I mean, we're responsible for our own safety, basically, our own policies and our own safety, and we're going to make sure that we don't put anyone in a position where they're feeling uncomfortable. You know, like Matt said, we do ask that people going out to a job site get a list of conditions that they're going to encounter when they get there, prior to getting there, so they know that they can feel comfortable. I want to make sure that I asked Scott necessarily, you know, given the conditions that we're dealing with, given that, you know, we have this propensity to visit a site less, you know, how this might affect our contractual obligations long term. You know, if we feel uncomfortable, or the contractor, we don't feel the contractor or owner, for that matter, is controlling their site correctly or safely, or we just don't feel comfortable doing that. You know, how we deal with that through an owner, through a contractor, and contractually, are our obligations lessened in any way?
Thanks, Bob. The first thing, obviously, I'd suggest that everybody do that has a question regarding what the duties or obligations might be in light of the situation is to take a look at your contract. And hopefully you have contracts in writing, and there'll be some guidance on that. But if you look at the AIA framework, for example, there's nothing in there that would alleviate design professionals' duty to conduct its CA obligations in that framework in the normal fashion. Obviously, now when a design professional architect is going to go out to a job site, you have to defer to the contractor's protocols for safety and for PPI and things of that nature, because they're the ones that control that work site. But there's nothing in the contract that's going to provide relief in terms of an architect staking out a position that, well, we don't have to do this, or we're just not going to do it. I think it's very likely that you're going to see something like that that's going to alleviate the architect from undertaking field visits per se, and that's what we're talking about here. Now, you can't do what you're not comfortable with, and so that's obviously always going to be a metric that every individual is going to have to undertake and analyze on their own. If you're not comfortable for some reason, step back and evaluate the situation, and you're going to have conversations with the contractor or people at your office and try to evaluate ways that you can alleviate any concerns you have. But I think, you know, unless something in your contract allows you to somehow not undertake a field visit, and if there's a pressure being applied to take a field visit in person, I think you're going to probably have a duty to do that and live within the requirements provided by the contractor, and undertake it as best possible with social distancing, wearing masks. And I know there's a lot of questions out there about masks, particularly in an in-office environment, but there's nothing in the governor's orders that requires masks per se, except for in enclosed public spaces, grocery stores and things of that nature. There's guidance that suggests that in an internal office setting that masks should be encouraged to be worn, particularly if you can't social distance and you're going to be within 6 feet of individuals. But there's nothing legally compelling the use of masks, although it may be prudent and a good idea on job sites. But you can certainly wear one. I would urge people to wear them if it makes them comfortable. If you're not going to wear one, ask the people around if they're comfortable with you not having one on. But no, to your point, Bob, there's not. I don't think, and every contract's different, but in general, I think the duties are going to remain the same in terms of an architect's duty to undertake field visits and to live within the environment and protocols provided by the contractor at that site.
Part of that question was who's responsible on the job site, and per the executive order, our interpretation is that every job site has to have a quote unquote COVID supervisor. So we make sure that at least one of our team members are named as that. And I think that what ties into this is from a safety aspect. Part of our reorientation of the site was kind of going through the why with the trades, helping them use their toolbox safety talks to be able to talk about those whys. To the point of the non-medical face covering, we try to use the approach of it's not just the physical, but it's the emotional safety. The hard hat is to protect you. The face covering is to protect you as well as your coworkers and their families, right? So it's a choice of, you know, trying to support what we all feel is socially acceptable. And again, we're not kicking people or removing people from the job site that are struggling with their face masks. There's lots of challenges with the face coverings, with fogging, safety glasses, and those kind of things. So we're really just trying to work with them from a common sense approach and trying to come up with different ways to make the face covering still safe with the work that they're doing.
Yeah, and keeping with that, Lauren, if I can interject here, and I know that this came up earlier, but Todd raises a good point in terms of who's going to be in charge and the enforcement aspects of this from a legal perspective. That's a tough question, and this is a new world. We're in a brave new world in terms of how all this is going to be interpreted, particularly from a legal perspective, and what the implications will be. But if you're going to have, and you're required to have, a preparedness and response plan relative to COVID-19, you're going to want to ensure that you have some measure, particularly in the contractor setting, of enforcement of that. The governor's order points everyone to guidance from OSHA as to what the requirements are going to be. So this is going to be something that falls within my OSHA's purview, and whether or not they'll be citing people for failure to have effective training or failure to or having workers on a job site that weren't complying with the governor's executive order, that remains to be seen. I imagine there will be some enforcement activity, but if my OSHA is going to be having compliance officers on site, and they're going to be noting that people are working in close proximity to one another without masks, or the health and safety plan doesn't set forth proper preparedness programs for COVID-19, you could be cited for that. And the defense to those citations will fall back to whether or not you were enforcing things if you had something in your plan that indicated that this was prohibited behavior. So, that's a tough question in terms of how strictly you're going to enforce these things, but the on-site person responsible for these things should be enforcing it on some level to ensure that, that you're maintaining safety, number one. Number two, that you're not going to run afoul of what could be some MIOSHA enforcement activities. This then dovetails into a question a lot of people have, and I saw it on the list already, as to whether contractors, design professionals, et cetera, are going to be liable for people getting COVID-19 while on these job sites. And as it stands now, there's nothing that prohibits that. I remain hopeful that we'll see some legislation coming down the line that will put a prohibition on claims against employers, legal claims, lawsuits by employees that happen to get sick. There'll probably be some prohibition on that already through workers' comp, but you could be on a job site, you could be seeing claims for people that contract COVID-19 from subcontractors against a contractor and things like that. So that's something that's being discussed on a state and a federal level. If there's going to be some sort of reform legislation that would limit a party's ability to pursue claims involving COVID-19, but as of right now, there's nothing out there that prohibits those types of claims. So that's, again, a further reason to make sure that you're enforcing these policies that are put in place and that you're complying with them.
Thank you, Scott. Appreciate that. So, Ryan, with all of these different sites that might have different standards, and of course, a lot at risk here as far as potential liability and people getting sick. Since you helped develop some of these guidelines, how should contractors share site-specific plans with subs and inspectors, delivery drivers, etc.? What's the best way to communicate those things?
I think a lot of projects took the benefit of the reopening happening on a Thursday to wait to actually start up projects until the following week, Monday or Tuesday. And so I think a lot of that communication was able to occur on that Thursday and Friday when projects were able to open up. There were a number of projects that did sort of a soft opening on the Thursday and steadily brought back teams in phases. I'd say that's I think more of the experience. I mean, you mentioned delivery drivers. That's always a challenge because the 80 to 90% of the folks that are consistently visiting project, or that the project is their home, tend to be following guidelines very well. We've had very little challenge with people adapting and embracing some of these guidelines and expectations and best practices in many cases, because I think people want to be safe themselves by and large. And so, but certainly, it's an ongoing battle. And I think Matt might have mentioned it earlier, that concept of just looking out for others on the project. You are your brother's keeper. And I think we've seen a lot of camaraderie and very little, very few incidents over the course of the last couple of weeks or so.
Well, we have quite a few people who have expressed concern in their previously submitted questions and even in the chat right now about incidences. So what happens when you run into people with lax attitudes or workers that are not taking the safety guidelines seriously?
I guess if that's directed my way, I would encourage no different than whether you see someone not using fall protection or not wearing a hard hat, or unfortunately, vigilance as it relates to safety is an ongoing threat and challenge. And so, it's regrettable to hear that those circumstances maybe are being observed or occurring. I haven't heard of many of those circumstances on some of our projects, but I would just encourage, first and foremost, practice emotional intelligence. Try to understand why is someone readjusting their mask. I think Todd had mentioned that a little bit earlier. There are some challenges in working with masks, with safety glasses or whatnot. But try to understand, and then too, as well, I believe Todd had mentioned, the order does require a designated person, which is a common term for OSHA and MyOSHA, and designated person for COVID-19. And I would suggest that if there are concerns, whomever sees those or has those concerns should identify that person and reach out to that person.
And they would be subjected to your same graduated disciplinary program that you would for, as Ryan hit it spot on, as you would for any of your other OSHA violations in terms of regulations for PPI. If someone doesn't wear a hard hat on a job site, the superintendent or the designated person would give them a warning. And then most people, if they've got a great health and safety program in place, there'd be a warning, then there'd be some sort of disciplinary measures for a second occurrence and things like that. So that would be probably the best way to handle the disciplining.
Thank you, guys. So we have a lot of really specific questions that I want to kind of shift the conversation into, so we can make sure that everybody who joined is represented. We had one person specifically who was interested in how inspections are handled in jurisdictions where municipalities are not willing to provide inspectors, and whether or not you've ever run into a situation where you could not get an inspection because of that reason.
I can take that one on. So as I said, my project has been going on through this, the entire duration before the executive order. And our jurisdiction did say that inspectors were not going to site. And I think the verbiage was that a design professional should perform the inspection and send it to the city, which I was pretty miffed about that one. If they weren't willing to go, then why should I go? So my bosses and the owner and the CM all got together to figure out how are we going to accomplish this. Got folks like Scott involved. And what we ended up doing was creating it's actually called an observation form. So we are in no way doing an inspection, but we are providing kind of this service to the city to go on site, make observations, take lots of photos, and then submit that to the city. That, of course, had to be approved by the owner. The owner had to be okay with that. And full disclaimer, they were not so happy about that because that's what they were paying the city to do. So they ended up, thankfully, paying us to do that because that's not generally our job. So that has been challenging, but it's been a lot of communication through the city, through owners, us, and the contractors. And we are very hopeful with the executive order being lifted that the inspectors will come back on board so that I don't have to do framing inspections, or engineers don't have to do rough-in inspections. But it has definitely been a challenge.
Todd or Ryan, have either of you run into that scenario where you've been held up in terms of schedule because of a lack of inspections?
Yeah, we've been fortunate, though we're connected with the project that Danica was talking about. We started that proactive conversations immediately, and it was interesting because that municipality was really driven by one person's concern, and we had inspectors that wanted to come on the job site. So again, you have to work together for a solution. Our other sites, we've had some state inspectors and have really no concerns. It's been kind of the time of day when they come to the site, trying to help minimize the number of people on site when they're there. There's been some minor delays. I sit on a few boards of some organizations, and one of those is having a project going on, and the project can't get started because the footings can't get inspected. So it's happening out there. And I think the other thing that you need to be prepared for is you're going to have pent up demand for inspections too. And so once the executive order allows people going back in general, that there's going to be some delays as it relates to that.
And what happens in situations where you might have an owner, not even an inspector, who is adamant about such things as in-person punch lists? How do you handle that situation? Nobody?
Well, I'll chime in, Lauren. I mean, again, you can defer to the contract, and I've seen this question out there, and maybe Ryan, with his involvement at Merck, can help a little bit on this one point. But it seems to me that architects are included implicitly in the executive orders that allowed the return to construction, because construction can't really be done without architects fundamentally in terms of plans, CA, etc. But I don't know if that in Ryan's dealing with Merck that's been clarified. I haven't seen it in frequently asked question response, and I saw it as a question in the chat group here that people are wondering whether someone can tell an owner that, hey, we're not going to go out and do a punch list inspection, or we're not going to do a field inspection because we're not required to be back to work, or we're not essential and can't go back to work under the executive order, because it's unclear as to whether architects are included in the delineation of construction, mechanical contractors, et cetera, under the order. But to my mind, the contract, there's nothing in the contract that would allow you to not go on site if the owner is requiring it, and properly protect yourself and undertake a punchless inspection or field visit, whatever the case may be. But I am curious to know, Ryan, sorry to burden you with that, whether there's been any clarification on that with your group.
Yeah, I think if you look at other industries, the connectivity and supply chain, I think is reasonable to apply to architecture services as well. There was, I'm not sure if it made it into the specific Q&A posted online, but a question was asked very early on before the return to work actually happened, whether steel fabrication was, was a part of construction. And again, the feedback back from the state was that yes, it is intended to, or the feedback from Leo is that as an industry returns, it is all a part of that ecosystem, and that's required in order to complete the work of that industry. So clearly, architecture services and specifically CA services would be included in that.
So Matt, I want to direct a question to you because I think you've had some experience with this. We had a question about how physical samples are handled during this unprecedented situation when photos really aren't sufficient enough.
Yeah, so fortunately, our contractor's been very good at just using standard mail to get samples shipped directly to my office or to my home office. So that really hasn't affected my remote working. So again, the more we can handle things remotely, the better. So that's a simple solution to that.
And Dinica, what has your experience been in materials?
Yeah, we've been doing a lot of trailer curbside pickup. So luckily I'm not very physically far from the job site, so I can just drive down there, grab the sample. And we've also been utilizing parking lots a lot for meetings. So we'll look at stuff out of the trunk of my car, I'll back up, let the owner move in, check everything out, make sure it checks out okay. And so that's kind of how we've been dealing with that. If I could just go back to that previous question about what's required, because I think I started as a disclaimer that I have anxiety about, and I don't think that's going to change when the executive order is lifted. So I think we talked about very early on that safety is still of utmost priority. And for me personally, I would have no problem still going to my bosses and saying, hey, the owner is telling me I need to do this, but I don't feel comfortable doing this. And I have to believe in these crazy times that I've heard stories like that, but maybe just through some very careful conversations, we aren't putting people at risk. And as Todd said, even if that's an emotional risk, even if it physically isn't there, but just emotionally, mentally not feeling comfortable with that. So I hope that I totally hear what Scott's saying, what's in the contracts. But I think we just have to keep in mind the emotional safety as well.
No,
So
we're
kind of wrapping up the conversation, Scott. So if you want to do a quick comment, but then I'd like to ask one final question.
Just real quick, I want to follow up. I didn't mean to be suggesting anyone should be forced to do anything. I think because there's so much unknown out there, people should only do what they're comfortable with. And if something's uncomfortable, by all means, initiate a dialogue. I think we're in an environment where everyone is going to try to cooperate with one another. And unless they're extreme, they're not going to be forcing people to do things that they're not comfortable with. So that's always the first course of action. And I think hopefully people will continue to work together cooperatively. So alternative solutions and arrangements can be made if somebody's not feeling particularly comfortable.
Thanks, Scott. So Anne has just asked an interesting question. Is anyone dealing with sites where consultants are needed but are out of state and would need to fly in? And if so, has anybody been handling that remotely? Anne, I know you do a lot of work in California. If you want to unmute yourself and briefly expand upon that.
This is Ann Belcher from Quinn Evans, and we don't do California work, but we have we have some big projects here where we have consultants and we're nearing punch list time on pieces of projects, and those consultants may be in Boston or other locations. And so we're just considering what our messaging is to them and our workaround on that, thinking it's when it's a close site and it's us going to the site, it's one thing, but trying to understand those issues.
Thanks, Anne. So Dinika, you want to comment on that?
Yeah, I just had a thought, and we haven't had that experience of someone that far away, but we actually do have some project team members who have compromises with their health, and so we've actually used FaceTime. It is kind of awkward, but that way they sort of feel like they're walking the site with us, and they can direct us individually to say, hey, can you zoom in on that, or give me some direction on what I'm looking at, and they usually have a set of drawings with them. So it's not quite the same, but we have utilized FaceTime.
Thanks, Dinika. So really along that line, and Todd, if you want to comment on this, I mean, should architects and contractors just consider these short-term solutions, or are we really starting to think about how we interact and change the standard of expectations going forward?
I know as an organization, we've talked about, you hear the terms, the new normal, and I think it's going to be very interesting, some of these things that stick, that really help us down the road be more efficient in our businesses. And please understand, it's kind of unfortunate reading some of the chat that there's some contractors out there that are ignoring the COVID-19 policies. I guess in any community, any society, there's always those that the bottom 10%, I guess, that don't want to follow the rules. But in general, we're happy to be eyes and ears for consultants if need be. 360-degree cameras, scans, drones. Those are some of the things that we've used. And then as Danica said, I'm doing some consulting, owners repping on a project in Nebraska, and we have a medical equipment vendor that's right in the area, and the architect's out of Wisconsin. And so we've used him a number of times during the design phase to go in and FaceTime and take some video and be the eyes and ears for the rest of the team. So it's very interesting because they get different parts of the country. They're kind of like, what do you mean COVID? Right? They aren't experiencing some of the things that we've experienced in Michigan just from the gross number of cases. So, but again, as a team, you should really be a team. And so don't be afraid to ask and figure out how you can solve it together.
Yeah, this is Bob. I know we're running out of time, and I thank everybody. What I was going to say is that, echoing what Scott said, is that I think what I've found is that across, even general interactions, people are being very cooperative. People are being very gracious about respecting one's individual feelings about what's going on. And we're basically, again, when we talk about construction, we're 2 to 4 weeks into this. And as I mentioned last week, I mean, there's no right answer. Number one, as Scott said, and I said earlier, you have to do what's comfortable for you. I think we need to be inventive. And, the idea of a new normal, as it was 30 days ago, will look different than it does today. It's going to look different again in another 30 days and another 60 days. And, hopefully this is a short-term situation, but we don't know that. So I think we need to continue to be inventive. And I think, as you said, Todd, we're all learning lessons about how to be more efficient in our business, and that perhaps some of the things that we do or did out of habit maybe aren't even necessary anymore. So I think, this is an opportunity, and I like to keep saying that, is that, the situation right now is an opportunity to relook at our business as whether things slow down or we just have to operate in different ways. I think, we continue these conversations that we have and continue to adapt the way we work and, maybe do it smarter. And I think it's an opportunity for us to all do.
Thank you, Bob. I really like the option of looking at this as an opportunity rather than an obstacle. And I really would like to just extend a very large thank you to all of our panelists today. You guys, the conversation wouldn't be the same without you. Just to respect everybody's time, I do want to close up the conversation and put up this one final slide and let people know that that we will be sending out the recording to this session along with some of the resources that were mentioned, especially from Ryan and Scott. And so thank you everybody for joining us today. Really appreciate you being here, and just be on the lookout for future AI Detroit and AI Michigan webinars to help you through this unprecedented time. Thank you, everybody.